Hey kids, it's Bill, the knee pain guru. Today is, what is today? Friday, November 6th, 2020. We got some questions in. We're going to answer some here in just a minute. I got a list of them that have come in over the past couple days. If you have questions about your knees, your knee pain, physical therapy, doctor's diagnosis, whatever it is, enter those in the live chat. We'll be addressing those today. Without further ado, we're going to scoot on over to the questions that came in. These came in YouTube and Facebook. So we will address those now. And while you're waiting for my computer to come up, make sure to give the video a thumbs up, like and subscribe to the Knee Pain Guru YouTube channel. Turn on notifications for future videos as we do these videos several times per week. Let me see here. Okay. Question here. First question is from let's see. Vincenza Periano. Help getting manipulation under anesthesia on November 12th. I'm assuming can't bend my knee. So I'm done. Please help me. Don't know what I can do to my knee. Okay. Manipulation under anesthesia. That's where they are putting you unconscious and then bending your knee to get the range of motion. So you wake up, your knee's going to be pretty darn sore. And the idea is you've been working with your knee to strengthen your knee to increase the range of motion. Unfortunately, what happens is the more you try to strengthen your knee, the more you're going against what the nervous system wants to do. Your nervous system is the command system for everything, meaning what's going on in your brain and your neurology of your body is letting your knee know whether it can bend or not, because it's been through a trauma, it's been through an injury, a surgery, something that is telling the knee, hold up, don't move, don't bend. And what ends up happening is scar tissue builds up because it's part of the protective mechanism that goes on with the knee joint. And from the medical model perspective, it's like, well, we got to push through that. But you push through that, it creates more pain for sometimes days or weeks later, which causes the body to tense up more, which makes it harder to increase the range of motion in the knee. So it's like you're on a hamster wheel, and the more you try it, you're just going backwards. Anyways, so how can we help Vincenza? We start changing the neurology in the knee joint by working with the knee joint in a position of comfort. This begins to send a signal in the knee throughout the rest of the body to the brain to tell the knee that it feels safe, supported, listened to. The knee relaxes. The range of motion begins to increase. Now, it may not increase fully, but it increases a little bit. And that increased range of motion allows for an increased comfortable range of motion, which can begin to break down the scar tissue. The comfortable range of motion increases. It makes it easier to move. It makes it easier to strengthen everything. So we lead with comfort. Comfort is the key to increasing the range of motion in the knee and allows the body to move forward in the direction that it wants to. So, Vincenza, you can head on over to, well, there's a couple things you could do. One is you can head on over to my website, kneepainguru.com, watch the video on the homepage. That'll start getting you in the direction. You want a bonus credit, join my program, Knee Club, my coaching program. And that will, it has all the tools. Right now, we're just talking about stuff, and you have to have the right mindset. A lot of people still want exercises and push through the pain, and they're not ready yet for what I have to offer. You have to be in the right mindset so I'd actually be able to help you. So that's the piece. Head on over to my website there, and then we can go from there. We got some comments here from Bronson Badley. Hello, full quadricep tendon tear survivor here. Did you have surgery? Is it repaired? That's my question, because sometimes it's important. We can't just jump right into giving things to do, because we need to have more of a context on what exactly is going on, so we have a strategy on moving forward based on if the tear healed on its own, or you had surgery, or what you're experiencing in the quadricep tendon right now or in the leg right now. We'll know how to build out a strategy to figure out what's going on moving forward. We have a question here from Monique. Knee arthritis. My knee feels like bone on bone during running and bending, pain when bending and weight on it. What's the best thing to don't to ease pain so I can continue to run and exercise? Monique, depends on if you want a long-term or short-term strategy. Short-term strategy is, would be your conventional approach. Rice therapy, what the doctors would suggest. If you want a long-term strategy, then we're going to need to back up a little bit and start creating comfort in the knee, and then set up the conditions so your body is able to heal the arthritis, because all diagnosis of arthritis is dehydrated joint. So we have to begin to set up the conditions, one, to get the knee comfortable, then to begin to allow the body to rehydrate the joint. And then once we begin to rehydrate the joint, then begin to systematically get back into movement, because the pattern that's going on that is causing the knee to dehydrate is not only in the knee. It's causing the bone on bone and the pain when you're running and bending. That's not only in the knee. That's also in the hips, lower back, hamstrings, quads, shins, calves, ankles, and feet. So, short-term strategy, probably go with the docs or the PTs. They'll be able to help you. You want to go for a long-term strategy, we can map that out. I do that every day in my knee club program where I work with clients. We'd figure that out. First is getting you comfortable so it doesn't hurt so much bending, and then the running comes later on. Okay. And that's where you can go for more information. If you have questions, please enter those in the live chat. We're doing live chat right now. We are going through questions that have been sent to me through Facebook and YouTube over the past several days. Okay, abnormal planes subbed today. I wish you were closer. So many old school rehab folks here. I'm having trouble with range of motion, but my buddy knows what to do better than my rehab folks. And he also writes, strength and bending. I wasn't active unless it was working 7 days a week. There wasn't really a question there. I'm not really sure what was going on. However, I don't work with anybody in person. I'm strictly online. I get better results with people online than I do with those in person, than those for people who see people in person. Because ultimately, you're the one that feels the pain in your knee, and you're the one that's going to have to get your knee out of pain. Ultimately, the docs can't do it. The physical therapist can't do it. I can't do it. I can't get you out of pain. You need to learn how to get yourself out of pain. And at the same time, you got to set the bar higher for what your body is capable of doing. Most people set it pretty low. They're like, oh, well, that's just what happens because this happened to me. I fell off a swing when I was 2. Or the dog hit me in the knee. And that's just what happens. That's how my knee's been ever since. Yes, that happened to you, and we acknowledge that. But in terms of your body's capability of healing, it's much, much greater. It has an infinite capacity to heal itself. And many times, if you're not seeing the results you want, you're not having the performance in the knee that you want, it's a direct result of the things that are in your body's way of healing. And all I do in the knee club coaching program is point those out to you so you can begin to remove them from your life and set up the conditions so your body moves into a place of healing and recovery and everything that you want to do. And that requires your head to be in the right place for that to happen. If you're still going into it with the old framework, the old mindset, the old paradigm of what you've been told to this point, which is, I got to strengthen the legs in order to get the knee out of pain. I got to stretch it. I got to push through the pain. No pain, no gain. Pain is weakness leaving the body. It's important that that mindset will never get you to a place of being out of pain. Pushing through pain is good when you don't start out in pain. When you start out in pain and you push through pain, you will never get out of pain. That's why you hurt for days later after physical therapy. That's why no matter how much you try to strengthen your legs, you will never out-strengthen the pain that you're feeling in your knees. That's kind of how it is. Okay, question came in. There you are, Abnormal Planes. Hi, I can't afford the knee club at the moment. I've had a total knee replacement September 25th, and I have a DVT in my right knee. I'm not sure what DVT is. I enjoy what you're talking about. I'm glad. Yeah, they're like this. I'm able to help a lot of people this way. There's layers and levels to this game. Like, I've been doing it for 22 years. I blew out my knee, dislocated my left knee 4 times. My learning curve was pretty flat, had ACL reconstruction in my left knee. They took out 2 pieces of meniscus. I got on the other side of the surgery and the physical therapy and was going, this is it? I'm in my late 20s and this is as good as my knee's going to get? No, that I didn't settle for that. So it's been a journey for the past 20-some years. I've learned a thing or two of how the body works, how the body heals. I've used myself as a guinea pig, and I've put all that into the program that I'm able to help people with. So, okay. Let's see. We got a question here from Angie Carter. If you have bone-on-bone, bilateral, and chronic fatigue on top of everything, then what can be done? You're always going to have a different diagnosis. Doctors have to put a diagnosis on what's going on in your knees in order to treat you. They have to have a diagnosis. They can't just go ahead and give you prescription drugs, shots in your knee, cortisone shots, or prescribe physical therapy, or do surgery unless they give you a diagnosis. So the diagnosis is not you. And what I've seen happen many times is people get a diagnosis and they immediately identify with the diagnosis that that's what is going on. So there's this idea that in terms of how I look at the body, how I look at the knees and how the knees are able to heal itself, we have to shift the mindset from the diagnosis to what are your issues. Do you have pain? Do you have stiffness? Do you have difficulty with range of motion? Do you have difficulty extending or bending? Do you have difficulty pivoting? And the more we can relax the tension patterns in the area that you're experiencing the discomfort, and that discomfort goes away, whatever that is. Pain wakes you up in the middle of the night. You can't squat down to play with your kids or your grandkids. You can't golf. You can't, whatever it is. If we create comfort in your knee over and over again, your body relaxes, and all of a sudden you don't have this experience. Do you care what your diagnosis is? Most people will say no, because you are not your diagnosis. The diagnosis is what the doctors give you to treat you. So it doesn't matter if you have bone on bone, bilateral bone on bone, or chronic fatigue. That's not the issue. The issue is the pain, the discomfort, whatever it is. And we start setting up the conditions to create comfort in your knee and in your body over and over again throughout the day. And the conditions so your body can heal itself. So what? So what about your diagnosis? The only thing the diagnosis is good for is to determine if something is broken or torn. Once we determine something is broken or torn, it sets we have the information we need to set up the strategy on how to get you out of pain, which may or may not include the Western medical model. It depends on what your priorities are and what you want to do as the ultimate goal of what's going on in your knees. Okay. Abnormal Plains says, I have a low pain tolerance. Last therapy session was 2 hours, which messed up my knee. DVT is a deep blood clot. Oh, deep vein thrombosis. I think that's what it is. Clot in my total knee replacement in my lower right leg. Yep. Low pain tolerance. And so my program, by creating comfort, generally works a heck of a lot better than pushing your knee through pain to get you out of pain. It doesn't work. Okay, question here from Kemma. Hi, Bill. I have a problem in my right knee. I feel discomfort when walking. Is me chems? Okay, what should I do? Well, for my approach, we're going to create comfort in the knee by getting the pressure off of the nerves, working with the intrinsic movement of the joint. I know it sounds kind of fancy. It's actually simple, creating comfort in the knee. Your nervous system, the nerves, like your reflexes that are firing all the time, that digest your food and cause you to breathe and makes your heart pump and all of that. We start learning how to use those reflexes to create comfort in your right knee when you're walking in a certain way. The walking could be when you're pushing off the leg or when you're stepping forward. Is the leg straight? Is the leg bent? All of that we go into details in my group coaching program, which is Knee Club. And then I give you specific videos to work with based on how the knee hurts when you move. And then you work with that. You're going to have a result on the other side of that. I don't know what that result's going to be. And then the next time we talk after that, so that would be the second time we talk, you're going to say, hey, Bill, the pain moved, the pain changed, the pain got worse, the pain got better. This is what I noticed. And that allows us a path that begins to open up with your awareness increasing of what's going on in your knee. You relay that to me in the calls, and then I'm able to guide you as to, well, maybe you need to drink more water. Maybe we need to give you another video. Maybe you need to do the work in the video that I showed you. You need to hold it longer. Once again, I don't know. We can only be present to what's going on with the knee right now. Your knee hurts a certain way right now. It's not the past, how it hurt yesterday. It's not how it's going to hurt tomorrow. It's how it hurts today. And that's the only way we can create comfort in your knee is with what's going on right now. And then you're going to have another experience which takes you to the present at that point. And we work gradually to a place where you no longer have pain. Because your fastest way out of pain, shortest distance between 2 points, is a straight line. So the shortest distance between you being in pain and being out of pain is a straight line. It's comfort. That's the fastest way we'll get you out of pain. It doesn't matter who you are or what your diagnosis is or how long you've been in pain. None of that matters. What matters is we create comfort right now. And you could sign up for Knee Club and you get a quick start guide to begin working with right now. And then our next call's Monday. And we have calls on Mondays and Thursdays. We meet in formats like this, and then you give me feedback as to what happened. I let you know what you need to do next, makes tweaks and adjustments, and you go on this magnificent journey in discovering how your body works. And it's actually pretty friggin' cool. So I am moving over to the questions that are in Facebook. We have a couple more questions here. Hold on a second. Abnormal plane says pain, stiffness. My home therapist makes me sit in a chair with my knees bended. This is really painful. How does this help me? It doesn't sound like it does. There's this disconnect people have. We've lost faith in ourselves. If you like the video, give it a thumbs up, like and subscribe to the Knee Pain Guru YouTube channel. Turn on notifications for future videos. We will go, and because the person has letters after their name, a doctor, physical therapist, massage therapist, whoever it is, you'll go to them and they will give you, well, this is just going to help. But if it's causing you to hurt for days or weeks afterwards, like at some point in time, you got to go, well, there's a disconnect here. I mean, we can go to the beginning of saying, well, total knee replacement. They're going to saw off the bones in my leg and replace it with plastic and metal. When you're in pain for a long time, that sounds like a great deal because you no longer feel the pain in the knee. The body compensates in some way. The tension goes somewhere. But on some level, when the pain has been there for an extended period of time, that sounds like a great idea. And it's covered by insurance and everybody's doing it, so why the hell not? Well, I mean, think about it. If we remove ourselves from the situation and look at like an objective third-party observer and go, the doctor's going to cut off the bones in my leg and drill a screw down the length of my bone and then screw in this titanium and plastic joint that is only rated for 15 to 20 years. And they're waiting till I'm old enough because they want me to die with this so they won't have to do it again. You got to go, well, wait a minute. Isn't there a better way? Can't there be a better way than what the doctors are approaching? Maybe I need to learn about my body on a deeper level. So now you're already well down that path and you're sitting in home therapy and they're coming and they're cranking the shit out of your leg and it's causing you more pain. And you're going, but the doctor told me, the physical therapist told me, and you're not advocating for yourself and saying, this doesn't make sense. There's got to be something better. So, as you can tell, I'm partial. However, you have to look, you got to look at the bigger picture of what's going on. Is this what you really want? Your knee's never going to, no matter how good the range of motion in your knee is after a knee replacement surgery, it generally doesn't get past 90 degrees. Think about that. You will never get past sitting on a chair or sitting on a toilet once you've had a knee replacement. That's the reality of it is. So, you can guarantee one thing. You may not like what I have to say, but I will always tell you the truth. Okay, we've got another question here. Tashima, how are you? I hear a lot about total knee replacements, but not about what I have, which is knee flexion, both knees. Knees is slightly bent position at all times. Do you have any recommendations? Yes. Well, I have, it depends on your game. Like what level of game are you playing? If you're looking at physical therapy, then recommendations is they're going to tell you to strengthen your legs. or stretch your legs or force your legs like abnormal planes to get the range of motion. But if you have to understand that there's a pattern going on in your legs that is causing your legs to only go certain range of motion. It's stopping because your body doesn't feel safe on some level. And once we get that, we understand how the neurology works. We start creating comfort in the knee, in the hips, in the lower back, in the hamstrings, in the quads, in the shins, the calves, the ankles, and the feet. And what ends up happening is the body goes, oh. And when it relaxes, the range of motion increases. The flexion and extension increases. It feels easier to move, easier to get out of bed, easier to get up and down from a chair, easier to walk, easier to squat. And we're on the other side of that, we're going to hit another bottleneck, so to speak, another place where your body feels stuck. And then we create comfort in a very directed and focused area of your knees or wherever else in your body you're feeling that stuckness, and that begins to open up and increase the range of motion. And each time we're creating comfort, we're changing the neurology in the knee and in the body to get you more comfortable and increase the range of motion. So that's kind of like your daily thing that you're doing minimum twice a day, maybe more often. And at the same time, we're setting up the conditions to make sure your body has the right amount of water or supplements or food or whatever it is that needs to go into your system. Your system is your body. Your body is a system. The more we set up those conditions, the more your body is able to integrate these neurological changes that we're making by creating comfort in the knee. And then you experience this freedom and a different reality that's going on in your knees, in your legs, in your hips, in your lower back. She said they gave me 1 session of physical therapy. Okay. I'm playing a long game. I've been in this 22 years. So there's only so much you're going to get accomplished in 1 session of anything. So if you want more information, head on over to, I got a video for you at the end. You can check it out. I'll do it in just a little bit because I got to scoot here in a few minutes. Okay, here is where you can go, kneepainguru.com. If you like the video, give it a thumbs up, like and subscribe to the channel. Best thing you can do is share this video with your friends, the ones that limp. They're easy to spot. Okay. Lester wrote in, how soon can I have an appointment? You can go to kneepainguru.com and schedule an appointment. You could do it within seconds. Do I have an appointment? Yes, I do. kneepainguru.com appointment. You can go there. You can book an appointment with me. But understand, I want to manage your expectations on what you're going to get in an appointment. We're going to develop a strategy. I maybe can give you a few things to help you. But in general, the appointment is to develop a strategy. If your meniscus is torn, you've gotten a diagnosis from a doctor and you know what's going on in your knee, we can develop a strategy, whether it be Western medical model, whether it be a natural approach, whether it's integrated. My ability to help you is going to be limited in the context of an appointment. This is what I was telling Tashima. There's only so much you could do. You got to play a long game. If you long-term game in terms of getting the results that you want. If it's taken months, years, sometimes decades to get your knee to the place where it is right now, it's unrealistic to think that it's going to be a quick fix or a magic pill that you're going to get in 1 appointment that's going to get you out of pain. Told you. I will tell you things that are the truth. I will not lie. And you may not like it, and that's okay, because we're both we're on the same page then. Okay, Lester has a Baker cyst. I got a document that I'll send to you, Lester, that has a strategy, which is essentially in Knee Club. Knee Club is my group coaching program. We meet twice a week. Calls like this. It's a group of people. You let me know what's going on. I point you to the videos. You work on them. And then on the next call, we see how it's adjusted and changed and shifted for what's going on in your knee. Tashima, do you have increased range of motion? Kima, how does your right knee feel? Abnormal planes, what goes on in terms of your pain levels? It's going to change as a result. If you do something that causes pain, you have a feeling on the other side of that. If you do something that creates comfort in your knee, you're going to have a different feeling on the other side of that. It's about developing the contrast between what you're already feeling. It's pain right now. On the other side of that, we're creating a contrast, which is less pain or comfort, or developing your vocabulary so you begin to articulate and understand what that is, the direction that we're going. So we do that with a Baker cyst, same thing. Need an appointment sooner than November 27th. Probably can book an appointment with me on Monday. That would be the November 9th if you wanted to. So, and then you join Knee Club, we got a call on November 9th as well too. So there's that. So there you go, Lester. And I got a question from Sue Park. It was ACL, PCL, LCL, meniscus torn plus damage, MCL. Also, tibia is sagged from the knee. Doctor confirms still no issue with stability, but flexion is the problem. We are doing all we can for 8-year-old son. Hours of straightening exercise and physio to activate his muscle, but not really improving much. If we don't do it, it gets worse, so we keep going. Our goal is to make his legs straighten so he can walk normally and bend 90 degrees. Feeling desperation as a parent, we believe it is excessive scar tissue inside is blocking the movement. We try hard by pushing and moving the legs, but not progressing much. Also need to know how to get rid of internal scar tissue. It's the right knee. Please help. Absolutely, Sue. And we could do that. I also offer private coaching. So if you want to work with that, we could certainly work with that. But the concept is going to be the same in terms of creating comfort. He's 8 years old. Sounds like his knee's been through a lot of trauma. And the more we can get his knee to feel comfortable, good thing is that kids' bodies respond much faster because they don't have this preconceived notion of how the body's supposed to respond. So it makes it easier. It makes it easier. It just responds faster because kids aren't going, oh, well, it's supposed to hurt. No, kids are going, oh, yeah, mom, that feels good. Okay, great. It's better. And then they go do their thing. I got a 7-year-old, so I know. She doesn't have this belief build up that it's supposed to hurt to heal, or I got to push through the pain, or whatever it is. That is built into us by our parents or family or community, whatever that is. So it's all about how we train our neurology. Kind of simple. Okay. Those are all the questions. We're done. I got a video for you for those that are making it here to the end. I got to jump off the call here right now, but you can check this out. I thank you so much. If you're watching the replay, enter in your comments, share this with your friends, give the video a thumbs up, like and subscribe to the channel, and I will see you on the next one.